So, Rob, we have recently in our episodes been talking about modernizing benefit plans. And today I am looking forward to our two guests coming in to talk about virtual care. Now, a lot of benefit plans include virtual care, but I have learned something in getting to know these guests about, looking at another feature, another addition specific to pediatrics and child support through virtual care can make a huge difference in modernizing plans. So, yeah, I'm excited. And tell me, what are your thoughts? What are you hoping to get out of this episode?
You're bang on, Caroline. We're talking about modernizing benefits, and it's as companies are looking to provide kind of unique options for their team more than ever before. We know through studies that close to two-thirds of employees are looking for kind of other family benefit options of a lot of natures, and we've talked to several organizations that have been great over the last few series on our podcast. But this is an organization that definitely has a unique niche and for what they do called KixCare, K-I-X Care, that specializes in pediatrics, virtual healthcare support. You know, and I can say this as a parent, sometimes children don't get access to, a timely manner for what they need, whether it's physical or especially mental health. So this is kind of a critical one. If you know somebody that's a parent that might be dealing with a child that's waiting for mental health support, this is going to be a great podcast to listen to. And we have Adam Saperia, who's the CEO of KixCare, and Ashton Thornton, who's a pediatric registered nurse, and she's the director of clinical services at KixCare on today. Their passion will come through very quick. And more so, what I found surprising was the number of successful calls that people have. It's close to 90%, which is amazing, of resolution of issues. So I'm excited to bring them in.
Awesome. Let's do it. So welcome, KixCare. We're really thrilled to have two amazing guests today with us. I'm going to start with Ashton Thornton. Please introduce yourself and your background.
Thank you. Thank you for having us. So my name's Ashton Thornton. My background is I'm a registered nurse. Most of my experience has been in pediatrics, including sick kids in the emergency department, as well as child protective services for Toronto. And my role at KixCare is I'm the director of clinical services. So obviously very passionate about pediatrics and what we're doing. So I'm looking forward to this chat.
Welcome, Ashton. Our second guest joining us is Adam Saperia. Adam, please share a bit about your background.
Hi, Caroline. Hi, Rob. Thank you very much for having us today. I'm the CEO of KixCare. Very excited to be here to talk with you both today. I've spent my entire career in the Canadian healthcare space, and really excited about what we're doing here at KixCare and how we can help families and help organizations across the country.
Well, this is great. We really appreciate you both being here, especially with an organization that has a very unique niche in our industry. So we're excited to dive into your organization, learn what makes you unique for our listeners. And if there's one thing, Adam, that you want our audience to take away from today's podcast, what would that be?
We have 4 words that we say: kids aren't tiny adults. And so when we think about how care is being delivered, how virtual care is being delivered across the country, pediatrics really is a very unique area. And so our team says every single day is kids aren't tiny adults. What works for adults is not what's going to work best for kids. And that's why we're here specifically focused on kids and teenagers and providing that specific care to them.
I love that because, here we are in with Benefits Alliance, focusing on group benefits plans. It's, we start with the employees. The employees are at work, and now let's look at the rest of the family. You've got spouses, you've got kids. And so it's important to understand, what virtual care providers are out there and the services offered, but how in this episode, I hope we can really hit home to our audience why it's important to look at a specialty like KixCare in offering support for children. Because if children are not able to allow mom or dad or parental units to go to work, then that's where the productivity stops. So let's dive in. What would you say is the impact that that your offering has on organizations, on employers that provide benefits plans?
I think you just spoke to a very important point, Caroline, which is the productivity impact. And this impacts parents, mom and dad, whoever it may be, but the reality is the greatest impact is on mom. And the stats show that certainly in Canada, moms with young kids are losing as much as 6 days of work per year more than their peers. So, when somebody's not present, when somebody's not able to focus at work, there's obviously a direct impact on their work, on their peers, on the organization overall. We know when it comes to kids' mental health, 80% of parents are their work is being impacted by their kids' mental health. More than half of parents have missed work because of their kids' mental health. So one of the sayings that our team often uses is that parents are only as happy as their least happy child. And when there is a health concern, whether it's an urgent care issue, a physical health issue, a mental health challenge, it impacts the family, it impacts the parents, it impacts the workplace. And those numbers are being seen, and we hear it from our clients all the time.
Yeah, and especially for when you think about organizations, only pretty much a third of the people covered under your benefits plans are actually your employees, because they cover your, as you said, their spouses or partners, and then of course you add in children, and you definitely touched home there. Is that I think all young moms, deserve a cape that are working and caring for a CEO at their home, and busy jobs. And as you said, those are pretty prominent stats that you just spat out there, Adam. And I really appreciate you sharing that. So for the audience that's hearing about KixCare today, maybe I'll pass this to you, Ashton. Talk to us about what a normal phone call might look like in a situation where a mom or a parent are calling in, and maybe two, then can you give an idea of like how often you can resolve cases virtually for those same people as well?
Yeah, absolutely. And I completely understand it because obviously I'm here working and I'm a nurse, but I also wear the mom hat at home. And I recognize that we all struggle with different family dynamics of our children, and making sure that we have access to care is important. We women want to show up to the workplace. We want to be here, we want to be successful, but we also want to be successful at home as well. And as Adam said, our children's physical health as well as their mental health impacts how we perform at work and what's happening in our home life. And so we're fortunate enough to be able to support both. And the more proactive that we are in healthcare, the less reactive that we have to be. And that's really important because healthcare was meant to be proactive. We were meant to health teach and really inform and empower families and our patients on how to take care of themselves and how to keep themselves healthy, both physically and mentally. And so our virtual platform, the uniqueness of this gives us that ability to connect with parents and really be part of their parenting journey, to ask any question and to make sure that when their child is unwell, and we're in this like crazy cold and flu season and we're seeing all these children getting sick, and they're getting sick for extended periods of time. And, my son just had a fever for 7 days straight, and parents are concerned. I'm lucky to have that experience and background. But for people that don't, they need somewhere to turn. And for them to be able to just securely message our team of pediatric experts and get that reassurance or get that assessment on the spot, that allows them not only to care for their child in that moment, but to get that peace of mind that their child is okay and going to be okay. And we're here with them throughout that journey, because symptoms change and evolve over an illness. And so even with in-person care, when we're there, that's a snapshot of what's happening. And then the child goes home and something changes. But the virtual space allows us to really be with families throughout that illness or in those mental health concern and challenges that they're experiencing, or even like answer those questions about feeding and nutrition or growth and development, which really allows us to, again, be proactive and empower families and capture things in the moment. And so our platform has over a 90% resolution rate virtually. And I think Adam said, kids aren't tiny adults. And what we do differently at KixCare is that we're passionate about what we do. We have the staff and the right pediatric experts that are comfortable. I always say, you get this gut instinct when you're a pediatric trained provider. You know exactly when a child is sick. You're trained to look at the family as the center of this child's world and their care. They know their kids best. So we have to utilize their knowledge and our knowledge together to really provide this unique care to children. And that's why it has to be family centric. And that's why we do that. And when benefits think about family-centric offerings like our program, they say to families, we care about not only you, but we care about everybody that's in your household. And I think that as we modernize healthcare, hey, a blessing out of COVID, I think we really have ways now to help the family units be successful, taking care of their children's health and wellness, but also showing up at work and being productive and not being as absent because they have that right access in the timely manner that they actually need it.
You said something there, Ashton. You literally took the words out of my mouth, because Benefits Alliance, and our advisors within our membership, we talk a lot about modernizing benefit plans. And I can share with you too that the episodes that Rob and I have filmed over this past year, I really sense a theme, and the theme being there's not a one size fits all, right? You want to try to customize your benefit plan to all the different types of populations within your company. Now, when people hear the word customize, they may think, what is the cost and how that goes? But I think it's important to distinguish, and I will lead up to a specific question. In an employer's shoes, your typical plan will have your group of parameds, right? Your massage, your chiro, and everything. Everybody needs something different within there. I'm starting to form in my mind a virtual care package, right? That has, sort of similar different needs. So I start to think about families that have a pediatrician that they already see, or a family physician, that's the in-person experience, and you get referred to a specialist. So how do you position or talk about that bundle of virtual care with an employer, a business owner? And then I guess part two is communicating to employees about, why do we have 4 different virtual care providers, 4 different logins and emails and phone numbers? Like, it can be overwhelming. So that's a big question, but I'll both of you, I'd love to hear your thoughts on all of it.
Yeah, I'd say there's a few things there. One is, you talk about the different buckets of paramedical services, and mental health has certainly been a topic that's discussed a lot in recent years. And more companies are willing to provide those dollars towards mental health services, which is a fantastic investment. Those dollars are only as good as the providers that you're able to use them for. So when you have companies that are now putting more mental health or making more mental health dollars available to their employees, but it's a 9-month wait to see, whoever that appropriate provider is for your child, the dollars are nice, but they're not being able, you can't actually put them to use. And that's where, when we can provide those appointments, let's say with a pediatric social worker or psychotherapist, in a matter of days compared to 9 months, or maybe even more than a year, depending on where you are in the country, that is a huge impact that's being felt by the employee, by the family, by the child, obviously, but also how they're doing at work. In terms of, how this fits in with so many other services out there, one of the things that we've realized is, once parents join KixCare, they realize this is the one-stop shop for everything having to do with their kids. So they know, if I'm sick, I may go here or there, but if my child is sick, we're coming to KixCare. What we see is, depending on the company, we see companies where 70% of their parents are using our service. So we've got utilization rates that are dramatically higher than a lot of other benefit services out there. And we've got families that are coming to us 8 to 10 times a year on average. So this is not we come once, we're going to reach out to you if there's a sore throat once a year and that's it. This is very much, KixCare really becomes a part of that team for those parents. And so they're coming to us, whether it's a couple of times, in a row when there's one particular illness, or they're seeking care throughout the year, or coming to us for different reasons. We are the one-stop shop, but they are coming back to us over and over again. And the results are fantastic. 94% of parents said that they would recommend us to one of their peers. The results really speak for themselves. Ashton mentioned that, more than 90% of cases are being resolved virtually. And so combine all these results, and this is why we're seeing such fantastic pickup. One other piece that I'll just speak to, Caroline, and you mentioned people who have a pediatrician. Some people do. There's 1.5 million kids in Canada who don't have a primary care provider. This is a fantastic service for those who do have one or for those that don't. Obviously, having a pediatrician or having a family doctor is incredibly important in being able to go for those regular visits. Even the best family doctor, the best pediatrician is not going to be there at 3:00 in the morning when there's a fever. Getting an appointment that same day or next day is becoming increasingly challenging. And so we're here to augment that care. We're here to support in those areas where a traditional family practice office wouldn't support. And for those who don't, we're also certainly available to support 20.
You threw out a stat that your utilization is close to 70% in some organizations, and that's amazing. So for listeners, I think if we look, Caroline, at our entire block of business across Canada with all our advisors and the people we deal with on an employee assistance program, like aggregate basis, I bet you that's 8 to 9 times higher than a fully utilized EAP program. And, we thought coming out of the pandemic that utilization and just in a standard traditional employee assistance program would skyrocket. I thought utilization would explode. Barely moved. And I find that fascinating. So when you're speaking about these stats, I think it's so imperative to understand that people, is there a couple of particular areas? We've touched on mental health, and I kind of want to talk about that a little bit for both of you to see what are some of the big reasons that are unique why people are calling and maybe calling back a second time or third time.
Yeah, I'll maybe speak to that. And I think that one of the things that is important to understand is that why children's hospitals are who they are and what they do is because they build this ecosystem of amazing providers that utilize each other and their expertise. And they know when their scope stops, somebody else's scopes begin. And I think that that's really important. And so that's what we did at KixCare. We built this ecosystem of providers from RNs to NPs, pediatricians to social workers and psychotherapists and registered behavioral analysts and dietitians to really be able to take care of every element a child needs taking care of as challenges or concerns get brought up in their lives. And our ability to be able to say and I'll give you an example of a family that has come into our platform, originally came in because they were concerned about their child's focus at school. And this was a teenager who was having a bit of challenges. They kind of noted it. There was a little bit of family history. And so our team helped guide them to go, let's explore what's going on to learn more. So let's talk to a psychotherapist and see. And after a few sessions with that psychotherapist, it was noted that it was very likely that this child had ADHD and needed a formal diagnosis. And because we have our ecosystem, that child got to not only continue therapy, but then get to go to a practitioner to get that formal assessment and diagnosis. And I think that there is so much value that we forget. Many families don't know what their child needs. They don't even know what's going on, or they maybe think that it's something and it's not. But regardless if we get a diagnosis from a primary care provider, specifically in mental health, 1 in 5 children experience some form of mental health. And regardless with that diagnosis, we need to support therapy, not only for that child, but for that parent as well. That parent is the center of making sure that that child is successful and they're at school. So they're advocate at school. And so when we're able to, under one umbrella that is very accessible and virtual, when we're able to say, let's start therapy and then let's get a diagnosis to help you on that. And when a child then needs medication management, let's add medication because we know that that's going to be beneficial. And then for pediatrics, that child is growing and changing. One medication may work and then it needs something else. And we know with a lot of mental health, it's not just one diagnosis of ADHD. There's typically other things like anxiety and depression. And so it's really important for families not only to have that care navigation. I know I can turn to these trusted providers to help guide me through this. They can continue that care and connect me in the same umbrella to support this child and my family's needs throughout this journey, because it doesn't just stop. In adults, we know that when we feel anxious, we can go talk to somebody like, we're feeling good, so we're going to walk away now. And we probably wait till things get worse. But in kids, everything's evolving. Their lives are changing year over year. Social pressures look different. parents and family and home dynamics could look different from a day-to-day basis to a yearly. There's trauma that happens, there's divorces and separations, there's just so much. And so it's really important for families and children to be able to feel like they have somebody to guide them on this journey, whether it is their mental health or physical. And even children that have mental health are bound to have physical health. Like, we all get sick. And so that's the other element, is pediatrics is not transactional. And, there is a lot of wonderful other virtual healthcare platforms out there. And those traditional platforms work well for adults. But the reason why we are here today and we're thriving is because we know that pediatrics and the care that families deserve is very different. And we don't need to be transactional. We need to be with them. We need to be supporting them. We need to allow them to ask those big and small questions, those worries. And even when they have or don't have primary care providers, they're not always available in those moments, or they don't have time. And so we complement the system of public and other virtual healthcare organizations because we fill gaps in other ways to make sure that there's a level of continuity of care, giving these families a peace of mind that they truly deserve at the end of the day.
Well said. There's so much that you said in there that you want to dive further into. But what's currently on my mind is, I know inherently we all know that the sooner anyone gets help, the better. And I don't know if there's a difference here, but when you think about a child and, being as proactive or addressing a matter as early as possible, I inherently think that there's a greater impact if you were to let that wait versus an adult. We're grown, we're all kind of programmed how we think, how we are with our health. Talk to me about that. Is there a significant difference in getting early help versus waiting till crisis mode, which is what adults typically
Yeah,
do?
absolutely. And that, one of the number one admissions in pediatrics is dehydration. And really, we don't need to get there most times. But the reality is that it happens because they're smaller and they don't have all of that extra water. And so when they get sick, they're sweating, maybe they're vomiting and having diarrhea. But our practitioners can recognize right away what the symptoms are and manage that. So we think of something like gastro, which happens all the time for children. How do we know how to rest their bellies and then rehydrate them? And how do we slowly rehydrate them so that they don't go back to vomiting? And so many times families think, okay, the child is feeling better and we should just get them to drink a whole bunch. But the reality is that belly is still very fragile. And so we need to do small, frequent sips of fluids. And a lot of times, and like, I'm this way too, is even though I have this knowledge, is like, okay, they haven't eaten. Are you ready to eat something? And then, they fill up on something and then they throw up again. And really the trick is that if a child is hydrated with a variety of different fluids, they're going to be okay. And then we can slowly integrate certain solids, whether it's a piece of toast or a couple strawberries, into their diet as they see fit. And then if they vomit, we can do that break again and start over. But a lot of families don't have unless they've maybe showed up to KixCare and asked those questions or showed up to a pediatric emergency department, they don't have that knowledge for that next time. And so I think that looking just at a physical illness that happens all the time in pediatrics, we can see if we are very proactive with the symptoms from the beginning, we can prevent dehydration because we know exactly what we're looking for. We can monitor them for 24, 48, 72 hours, constantly checking in. And then we can, as something changes, we can tweak our care a little bit like we would in the hospital, just comfortably in the virtual space. And then when we think about mental health, is that children should never get to crisis moments. But the reality is that we don't always see at home what's going on, or we think that it's maybe this is kind of our life until it kind of falls apart and maybe a child starts having suicidal ideations or thoughts or self-harm, and that's when we get there. But if we start proactively teaching parents, and we do this through our webinars and our curated pediatric content that our families get access to, and we start teaching them, these are signs and symptoms of what to watch for. These are things that happen children at certain ages and stages may start experiencing certain mental health challenges or peer pressure. And this is a great time to start having conversations about gender identity and sexual health. And when we start being able to give parents those tools, then they can start watching in their home what's happening. And the flip side of it is then when they notice those things, they have a practitioner to turn to right away that's an expert to say, yes, this is normal, or no, this isn't. And I like to give an example of my daughter in particular, and I use my kids because I'm a pediatric nurse. I've been in this industry for almost 16 years and I love it. But again, every child is different and unique. And my daughter has always been a little bit anxious. And I've been able to work with her and teach her about self-confidence and being strong and brave and self-talk. But now that she's 8 and 9, mom's not always so cool and doesn't always have the right information, and she doesn't always want to listen to me. And so I said, it's not impacting her day-to-day life, but I think there's value in her speaking to a therapist. And so now I have her working with a therapist on our platform. And it's amazing because not only have I learned little things that I didn't even see in my home, but I've been proactive about it so that this doesn't get to a point where she struggles in other ways or potentially gets to those crisis moments. And then gets to hear it from somebody else who is there and shedding light on what other children experience and providing her coping strategies to be successful in life. And that's the value. Like, we all have mental health, and we've worked with some amazing providers. And one provider said it's about mental fitness. And our brain is so resilient, but we also have to teach our brain. We need to teach it how to cope. We need to teach it to understand when it needs rest or when we need to try something else. And so mental health should be thought like any other health and wellness. If we need our sleep, we need the proper nutrition, we need the proper supports in place and people to talk to so that when we have good days, great. When we're kind of in the middle, we're there. But when we're starting to feel like we're going the other way, we have somebody there to support us. And I think that that's where the COVID helped change. We allowed ourselves to start having honest conversations about how it impacts us. And then in turn, we were able to look at our children and say, wow, this really did impact our children. This really does. And so now we can be proactive and comfortable having these conversations and then turning to the right professionals to support them early so that we have less admissions and less children that are in these serious situations where they're starting to self-harm or feel like they need to, there may be desire to commit suicide or suicidal ideations. And so really that's where I think virtual space and being proactive is so valuable, and our platform being teachable and that asynchronous learning comes into play as well.
That's great. It's funny you bring up referencing your kids. I'm not allowed to, now that I have teenage daughters. They're like, don't talk about me. And then Daddy's got a podcast, and they're like, I talk in benefits. And they kind of look at me and then they walk away. I'm like, well, I think it's exciting. And I know a lot of people do. But from a serious standpoint, you touched on something that I think is so critical. And I'm such a believer that it's easier to help a child to try to help an adult that's already been dealing with so many mental health issues, maybe for years or decades. And, talk to us about the current, kind of state of pediatric mental health from your eyes. What are you seeing? Is it a crisis that, we need to address more and more? And maybe talk to us about how KixCare has been really supporting these families during a time where a lot of parents either find out a little too late, unfortunately, that their kid's been suffering for a long time. So maybe both of you could speak to that a little bit.
Certainly, I think you made the point, Rob, about parents realizing they've been waiting, and this is one of the challenges today. The wait times to get on, to get and see the right provider, generally across Canada, are averaging 9 months. We said in some places are 1 to 2 years. That is a long wait, and as Ashton said, kids change pretty quickly. You could be on the wait list today, and 9 months later, that child could be in a very different position. The other challenge, of course, is that parents don't even know necessarily where to turn. So they could be sitting on the wait list for this particular practitioner who could then turn around and say, you know what, you're actually better suited to see this particular kind of person. So getting that fast care, getting seen by the right practitioner quickly is really game changing. And I think COVID really sort of highlighted an issue that was already brewing. We know parents are talking a lot about concerns around social media and screen time and all of these different issues. And so getting that care quickly, getting them to see the right provider as fast as possible is incredibly important. putting those benefits dollars to use, as we were talking about earlier. It's a matter of creating that ecosystem and just providing that care as quickly as possible and trying to address this before it escalates. And also, again, address it while there is that opportunity before that child changes again.
Great point. And may I'll let Ashton jump in, but it's one thing that you have these dollars in your benefits program, but if people can't access care, that's what's a bigger concern, really. Yeah, sorry. Ashton, I don't know if there's anything you want to add to that too.
I think just like with my experience, even in the emergency department, so many families turn to the emergency department for mental health concerns and challenges. And one of the things that we constantly have to say is we will make a referral. And then the referral sits there and waits. As Adam said, the wait times are so long. And that's unfortunate because during that time, they wait with no information, no support. And so what we wanted to make sure that happened at KixCare is that not only did we not have wait times, and so to be getting children seen in as little as 72 hours, but we always wanted to make sure that they had care. So between those therapy appointments, who could they talk to? A pediatric registered nurse that has knowledge and training in mental health to continue to support them throughout so that even if they're started therapy and in that moment, everything's going sideways and you're like, the therapist talked to us about trying this and this isn't working. They could turn to that nurse and say, what else can I do in between this session? And so not only did that help expand those sessions, but it's giving families that have 24/7 access to us care in the moment. And so many families, when they showed up and emerged, they're like, what else? Where else can I go? What else can I do? And it's heartbreaking because they really just want answers. And so our platform has been able to do that because we're able to, from the second they reach out, start understanding what's happening, what's changed, how long has this been happening? Is there risk of self-harm or harm to others? And then who do they need? And how fast do they need it? And prioritize them within our ecosystem, connect them with multiple providers if that's what's needed. And I think that there's so much value to that. And once families start talking to each other. And I think, word of mouth is huge for KixCare. And I think that's the best success is that when families start talking about their experiences and how much we've helped them, I take really huge pride in that because when families start feeling the value of how healthcare is really supposed to be versus how it's been feeling broken for so long. And mental health has been underfunded and under-resourced in pediatrics for so long. And we've always wanted to do better. And I think COVID has helped kind of move that along. And the virtual space is now that next step. Kids are the most comfortable when they're in their safe space, which is at their homes. So why would we ever think that they're going to thrive in a hospital setting or in somebody's office versus sitting in their bed and talking to somebody or on their couch with mom or mom and dad or whoever is part of their family dynamics? And I think that that's what is the unique layer that also helps them thrive because the reality is that's usually at home when things aren't going well because this is their safe space, but it's also their place where sometimes some of their most challenging behaviors show. And so we can look at that space and start talking about those and really it connects with the children, it connects with the families, and it brings that truly specialized care that they deserve. And then again, it's all about access. Access is key to not only being proactive, but to really truly supporting the concerns and challenges as they're happening and as they're evolving and changing to make our children successful. They're our future. And if we don't start thinking about our children and their now and helping now, we really are setting them up for failure down the road. And I think that the benefit space is the perfect spot to start thinking about those changes and looking inside your home or your family's friends and families home and saying like, what are they going through? And you'll hear when you start having honest conversations is that the children and our family dynamics are truly our biggest challenge. So when that's supported, imagine how much more our children are successful, but then also parents that are working can be successful.
Yeah, that leads me to as we start to wind up this episode, I'm thinking back to the business owner, the employer that's putting benefits plans in place, and thinking about mom, dad, the caregiver as the employee, knowing that particularly I think for a mental health situation that If your child is fine one day and the next day not fine, you can be consumed, whether you're taking time off work or you're at work trying to get this appointment because this situation has escalated or something. Your child has been taught in school more than ever to speak up when I'm not okay, right? And you want to react when they're telling you that. So I really am starting to see the big difference between what KixCare does and, generally virtual care, and why an employer would, consider modernizing their benefit plan and offering multiple access points. So that's my big takeaway is I can picture myself at work knowing it's easy for me to get that next appointment. I've got my connection. We've got a plan in place. I can refocus. That's what I'm taking away. Let's go around the table and see what, when you think about employers and plan members and impact and communication around this, what would you say to help our listeners? Let's start with Adam.
Yeah, I think the results really speak for themselves when we have more than 90% of cases resolved virtually, when we see how often parents are coming back to get their kids looked after, and we see how fast we can deliver care. The results do speak for themselves. And so whether it is the plan sponsors or the advisors that are listening, this is a service that's available coast to coast in English and in French. We've got an incredible team working with Ashton of pediatric experts. We say the same nurse that you would see in a pediatric emergency room after waiting 8 or 10 hours is the nurse that you're going to see on our platform waiting less than 8 or 10 minutes. So it's the impact is immediate. The feedback that we get from plan sponsors, from HR, from executives is remarkable. And the best way to see it is to see it firsthand. Every organization, there's always one or two parents on the call where we'll be talking about what's available. We see them nodding their heads and they get it. And so we really are here to support Canadian organizations from coast to coast and make sure their parents and make sure their employees with kids are looked after. And if those parents are looked after and their kids are looked after, you're going to have a highly present, highly successful employee.
Great. Ashton.
Yeah, I think the most important thing is knowledge is power, right? Knowledge is power not only as you talk to employers and businesses about what they need and learning what they don't have or who is part of the family, like what does that family dynamic look like in their organizations? And that's the same as for parents. The more that parents have the knowledge, the more empowered they are to be successful. And every parent wants to show up at work. We started our careers out before children for the most part. We want to be successful, especially women. And I think that, we can find ways to complement other benefits offerings that are always there. But ultimately, when we think about our future and the economy's future and all of that, that's children, that's pediatrics. It's about time that they deserve and families deserve something that's unique and modernized that ensures they have access for all aspects of the health and wellness of their children. And they have somebody on this parenting journey with them and really has that pediatric team in their pocket, like we like to say. And I think that that's just really important. So when you're thinking about that is really kind of looking from the inside out and how we make a successful world run. And it starts with our little ones to raise them right and have the right access.
Amazing. I have one last question, and this could be really for anyone, but I'm going to go out and make an assumption, and I'll stay up front. I don't need specifics of pricing because that does change over time, and we know that people will listen to this podcast 5 years from now. So having said that, I'm going to make a big assumption that, we go back to that ParaMed example. You're going to have a wallet for massage. You're going to have a wallet for chiro. My big assumption is that your wallet for pediatric KixCare is going to be of a similar price point to other virtual care providers. So it's not like, that's my assumption. And then having said that, I'm going to come to Rob to say, when you think about positioning this, both value and cost with employers, because I know that the business owners listening are going, okay, tell me, what's the cost?
Yeah, and absolutely. And I think if you don't see the value at something at $10, you're not going to see the value of it at $8. I think is probably just starting right there, or whatever the cost is. I'm just talking dollars. From a reference from as a parent, that if, I always say like, hey, if I got sick, then I can deal with it, right? I can fight my way through it. Or if I need to take a day here, that I can play catch up. But when your kid is sick and you've got to take that time off work, or as we've been talking a lot about, if a child is mentally unwell and you're looking for guidance and support, and it could take months to see a specialist, you talk about a return on an investment as an employer to say to your team, I've got you. Not only because what people are looking for more than ever is access. And they want that someone to help them kind of navigate their health journey from that standpoint for their child in this case. And when you're like, first and foremost, when you talk about the passion behind an organization that's looking for solutions and solving 9 out of 10 situations why people call, I think from that standpoint, you talk about ROI back as a business. I think there's so many boxes get checked with our conversation today that I think is critical. And as I said earlier, yeah, I think it's a big believer. It's if you can help a child, that sets it up better than try to potentially fix an adult that's not mentally well. It's, there's all these other aspects that come into play. So I think it's critical to look at, as you said, you're looking to modernize benefit programs. And I can tell you, a majority of employers are looking at what are some additional family style benefits that we can offer to meet a diverse workforce, diverse that's more than it's been, in years gone by. So it's been amazing. So, Ashton and Adam, we really appreciate your time. We love your passion. Thank you for sharing some ideas and situations that you've helped companies and individuals that have called specifically into KixCare, and we really appreciate your time.
Yeah.
Thank you very much for having us. We certainly hope we'll be hearing from some advisors and some plan sponsors to reach out and say, we need this for our employees, and we're here to support.
This has been the Benefits Alliance Voice. If you enjoyed this episode, please share it with your network and be sure to check out the podcast notes for any additional materials.